So the first question is for Senator Franken, and it is, why is Medicaid being cut if we're talking about Obamacare?
That's a great question, and I guess you'd have to ask Mitch McConnell and Republicans in both the House and the Senate. I don't want this to be, I was going to say I don't want this to be partisan. I'm not quite sure how it can be. This is, again, I don't think this is, I was kind of curious when, after the election, what they were going to do, the Republicans, to do this, because they had been saying this for 7+ years, and but they've just been using it as a political target, the ACA, and doing everything they can to undermine it. So I was wondering what, they did not expect for Trump to win the election. And I don't think they expected that they would have to do this, that they would do, they wanted this as a political football and nothing else. They wanted to use it to win elections. And once it fell into their lap that they actually had to do something, I was kind of curious. I was kind of curious, like, okay, let's see you make a better system. You know, you're talking about Mayo, Brandon was. When I was running in 2008, and we'd have debates, Norm Coleman would say, we have the best healthcare system in the world in the United States because we have Mayo. And Mayo is not a healthcare system. It is a hospital. It's a clinic that provides the best care in the world, not as good as Gillette for Brandon's needs. But that's not a healthcare system. And in the United States, we don't have a healthcare system. We didn't have a healthcare system. If you were in Medicare, if you're in Medicare or Medicaid, you're in single payer. You're in the Canadian system. If you're in the military, if you're in the VA, you're in the British system. You're in socialized medicine. If you are getting it from your employer, your health care from your employer, you're in the German system that Bismarck started. If you don't have any care at all, you're in the Cambodian system. And the whole point of the ACA, the whole point was to get people in the Canadian system into a system. So we had the employer mandate, so people would be getting it from their employer in the German system. Or we expanded Medicaid, so people would get it, be in Medicaid, and be in the Canadian system. And what we did, we managed to cut in half the number of uninsured. And not only that, but we bent the cost curve. The cost of healthcare in this country, now the exchanges are an exception, as we've seen in the last couple of years, and because we've seen pharmaceuticals go up in the last 3 years, spike. There's a challenge in this, but we've actually bent the cost curve. The cost of healthcare in this country has grown at a slower rate than had been anticipated by the CBO, by the Congressional Budget Office. So we're making changes in the delivery of healthcare, like accountable care organizations, things that Minnesota has pioneered. This is why Minnesota has been the leader in terms of the value of care that we deliver. And our healthcare providers are fighting all the time to make it better. This is why Brandon is doing so incredibly well, because we provide great health care in this state. But this is nothing to do with health care reform. This is a tax cut for the people who need it the least. If you are in the top 400 income makers, I don't want to say earners because I'm not sure they earned it, but if you're in the top 400 in income in this country, you get an average of $7 million a year, $7 million a year tax cut. Because, you know, they need it. And what this is going to do is take away exactly what the people who spoke are talking about. And they're gonna, not all of it's gonna go away, they're gonna have to pick and choose, right? The state's gonna have to pick and choose. But this is ending Medicaid as we know it. Medicaid as we know it was the federal government pays in depending on the needs in the state. But now they're capping it, and not only are they capping it, they are capping it to grow at a smaller, at a lower rate than it does, than healthcare grows. This is just, there is no healthcare reform here at all. There's none of that.
Thank you, Senator. The next question is for Lynn Blewett from Nathan Place. It's a two-part question. How rapidly will any changes be seen in Medicaid services if the bill passes? And what are the strategies that states may take to counter any changes?
So in the House bill, it starts sooner. What the Senate did was extend the time period, so they stretched out the cuts and the costs. So I think within about 2 years, there's going to have to be changes, and they'll have to figure out how they're going to figure out the per capita costs. There's a wide range across the states in terms of how much we pay, and so there'll be some shrinking of that. There'll have to be a formula, but I would say within probably the next budget cycle, the state will have to figure out what to do. We don't have the provider tax that paid for Minnesota Care. That sunsets at the end of 2019. So that's not going to be available. We just had a huge surplus, 1.6 billion, that you know, we gave back a lot of it in tax relief. So, you know, we have to raise revenue or cut programs. So that's going to start within the next budget cycle, which will be in 2 years.
Thank you. The next question is for Senator Franken. How will the proposed Medicaid changes impact people who are not using Medicaid?
Well, this is not going to just impact people on Medicaid. For example, if you are getting your health care through the exchanges, what I see here, especially for people who are 50 years old and above, they will see their premiums go way up, and probably their co-pays will go way up because it changes the ratio of what the companies can charge for people who are older, from 3 to 1 to 5 to 1. So it's going to affect seniors. It also, another very, very alarming thing, we've only been talking about Medicaid, like today, as a horrible part of this. This also, the legislation as it's passed, will undermine protections for people with pre-existing conditions. Because under this bill, states are allowed to get a waiver to get rid of the essential health benefits that insurance companies have to cover. Now, once you do that, there are 10 essential health benefits, and one of them is like pregnancy, and so you can see the costs for pregnancy and delivery can get very expensive, and so a state can say, okay, you know, insurance companies are allowed to waive that, or insurance companies can waive whatever they want. So they can waive, you know, mental health and drug, you know, drug addiction and drug treatment. And we've heard about recovery. finances that may not be able to get it because that may not be covered in the insurance they get. People don't normally anticipate, or maybe they do. Maybe they've had problems with alcohol or drugs before, and they need that coverage, or they've had mental health coverage. Well, guess what? They're going to have to pay more because they're going to have to get an insurance policy that does cover that. So we're going to go back to, this allows us to go back to a time when people with pre-existing conditions are not going to be protected. And that is something that's very, very ugly aspect of this. And, I'm not sure how this works out. Say Minnesota says, okay, we're not going to allow any of those waivers. But let's say you work for a company that has offices in 30 states, and they decide to go get their policy from the state that does not cover, it does allow waivers, it does allow waiving certain essential health benefits. You may discover very quickly that you aren't covered for whatever it is you have. So this is going to affect more than just people on Medicaid, believe me. Is that about right?
Yep.
Hey, you want to add anything to that? What's our guess on whether that works?
I fixed it.
Yeah.
It was complicated. On button. You can call me MacGyver. Okay, we have a final question here before our guests need to move on. And we'd like a brief response from both of you. So this is from Donna in the audience. Both my 91-year-old mother-in-law and my 91-year-old mother depend partially on Medicaid for their care. I myself am also on Social Security and Medicare. I am caring for my 4 grandchildren while my son attends school and my daughter-in-law works. My bathroom is on the 2nd floor. There is no way I can take my mother's home to care for them. The question is, what will happen to them if they lose their Medicaid and with this new health care bill, if it passes?
Doctor?
The amount that is, there's just going to be significantly less federal funds, which will put a lot of pressure on the state funding for programs like people in Medicaid, people that we've heard today. And there's going to have to be decisions made about how much we cut and what we cut. I mean, unless there's some kind of groundswell to raise local taxes to backfill. I just don't see that as being, part of our discussion these days is let's raise taxes to take care of poor people. These are going to force really tough decisions, and it's going to be people in nursing homes, the disabled, moms and kids. Those are the benefits and the cuts we're going to have to make. I think the nursing homes, a lot of them will probably close. I think there won't be an option because they won't be able to survive with the. So I think it's dire for many, many families, and I'd like to say something better, but I think that's about it.
Yeah, this will be forcing us to make some cruel choices. And I was up at a nursing home in Moorhead, and what's interesting, when you go into rural communities and you're meeting with people who, I don't ask anyone their party affiliation or anything, but you know that in a rural community you've got some people who voted for Trump. And Trump did say, he promised that he would not cut Medicaid. I don't know, anybody remember that? I mean, not that it matters, but I mean, there's a certain expectation with him, which was, okay, so you said that. But I mean, I do, you know, this does affect people in all over the state, everywhere in the state. But actually, nowhere more than in rural Minnesota. And if you look at who voted for whom, you see that this is people who are being tricked, who were tricked. And there was never any intention here to reform healthcare. All this really is, oh man, we got stuck with the ball. We had no idea that we would be stuck with the ball. Now we have to fulfill our promise to repeal and replace. We have no idea how to do that. We're going to put, in the Senate, we're going to put 13 guys in a room who don't know much about health care, some of them. There were 13 senators, male senators behind closed doors, meeting, and Mike Lee, one of them from Utah, said he didn't know what was in it, like a week ago. So I don't know who wrote this thing, and I don't know how, but it is the most cynical piece of legislation, done in the most cynical way possible. We in the health, on the health committee, the health committee is health, education, labor, and pensions. I'm on the health, education, labor, and pension committee. Have been begging the chairman to have hearings on this, on how we can do things to make healthcare better and improve the way it's done. And a lot of it is how we do it in Minnesota, by doing coordinated care and getting rid of fee-for-service and rewarding high-quality care. We really do have a lot of ideas out there, and they're not ideas that only Democrats have and that Republicans don't have. There are ideas out there. None of them are in this bill.
I'm going to squeeze one more question in for Senator Franken.
Are you happy with this legislation? Is that the question?
I have a different question. Senator Franken, what can you do and what can the people in this room do to fight these Medicaid cuts?
Well, one thing you can do, it depends what happens in the next week, but you can make yourself heard over the week. First of all, you're here today, and that makes a difference because we have some media here today. And so hopefully they're going to have a nice long story on it. Let's see if they're here. Yeah, make a nice long story. They have Brandon and I hope they have the other stories too. But so in the meantime, we can continue this week to have our voices heard in all kinds of different ways. And one of them is to write senators, maybe not, I mean, both Senator Klobuchar and I are going to be voting against this. But there are others. If it gets past this, you know, maybe some of you live, I don't know, in the 2nd Congressional District. And maybe you can pressure, I don't know the gentleman's name. Maybe pressure him. Or in the 3rd. I know his name, but if it gets to that point, because this is, you know, you have to have both houses agree on a piece of legislation and then vote on it, and this is a bit of a moving target. Right now we have members on the right side of their party and one member on side of